Okay, welcome back to our next video in our lecture series on pharmacology. In this video, we'll discuss chapter number 5, Using Drugs Therapeutically. Learning objectives for this chapter: describe the physiologic basis of drug effects, differentiate between a local and systemic drug effect, describe 2 actions a physician might take to reverse drug toxicity, describe the physiologic basis of an allergic drug reaction, describe the physiologic basis of a drug-drug and drug-food interactions, describe the metric system of drug measurement, describe these other types of drug measurements: inches, units, drops, milliequivalents, percentages, and ratios, recognize and define Latin abbreviations indicating frequency of doses, describe how dose calculations are made for adults and children and patients on chemotherapy drugs, name the 7 rights of drug administration, and lastly, define the keywords and phrases for this chapter. A quick introduction: the effect of a drug exerts is directed toward 3 things: prevention, diagnosis, and treatment. Now, unfortunately, drugs can also exert some other undesirable effects. Now, drug effects can be altered by their interactions with various types of foods and other types of drugs. Now, drug effects are initiated through receptors. These are special protein molecules that are found on the cell membrane of every cell. And these receptors are specifically designed to interact with natural body chemicals, such as hormones, enzymes, neurotransmitters. And these receptors can also interact with drugs that we take. And the way that these receptors bind to natural chemicals or to drugs we take is called a lock and key method. The receptors on the cell membrane surface are considered to be the lock, and the drugs are the key. Now, certain drugs can activate or unlock these receptors, and chemically similar drugs can also activate the same receptor and produce similar effects. Now, a drug that is able to unlock and activate a receptor is called an agonist drug. So they'll bind to the receptor on a cell surface and produce an effect. Now, there are some drugs that can fit into the receptor but cannot unlock or activate that receptor. And these are called antagonist or blocker drugs. Their therapeutic action is to occupy the receptor site. So agonist drugs can't get to them and can't activate them. So these can block hormones, neurotransmitters, and other drugs from activating the receptor. This illustration has a quick lock and key model. So the receptors on the cell surface would be the lock, and then the drug will be the key. So in this example, this key would activate this lock and it would open it. For this illustration, an antagonist or a blocker drug would fit into the lock but isn't able to activate it. So by this being here, the agonist can't activate it. So it literally is blocking the agonist drug from working. Now, one drug can act as a master key, and this can unlock several different receptors in different organs and different tissues. So this accounts for the therapeutic effect of a drug and also the various side effects of a drug. There is a number of different types of receptors that are found in the body, and they all are specific to various types of agonists. The first one we'll talk about: adrenergic receptors, also called alpha adrenergic receptors. The symbol here is a Greek symbol for alpha. There are different types of these: alpha 1 and alpha 2 receptors. And these are going to respond to norepinephrine, which is a neurotransmitter found in the sympathetic nervous system, and drugs that act in a similar way to norepinephrine. And the reason why these are called adrenergic, this is a reference to the adrenal glands where norepinephrine is produced. The other type of adrenergic are beta adrenergic, and there are beta 1 and beta 2 receptors, and these respond to epinephrine. Epinephrine is more commonly known as adrenaline. So this is another neurotransmitter found in the sympathetic nervous system. And these receptors also respond to drugs that act in a similar way to epinephrine. Again, epinephrine is made in the adrenal glands, so that's why these are adrenergic receptors. Another type of receptor are cholinergic receptors. And these respond to acetylcholine. And the name cholinergic comes from the part of this neurotransmitter's name, acetylcholine, so that's why it's cholinergic. And acetylcholine is a very important neurotransmitter found in the parasympathetic nervous system. Another kind, histamine receptors. They're referenced as H1 and H2 receptors, and these usually respond in allergic reactions. I now talk about local versus systemic effect of a drug. So a drug can have one of 2 effects. It can either act locally or systemically. If a drug has a local effect, it is limited to the site of administration and the tissues immediately surrounding it. An example of this would be eye drops or ear drops. They will act locally. They will only act on the eyes or the ears that they are administered to. And if a drug has a systemic effect, it is felt throughout the body. It doesn't matter how the drug is administered or where it is administered. It is felt throughout the entire body, through your entire system. Now, some drugs will always have a local effect, and some drugs always have a systemic effect. An example of a drug that always has a local effect are drugs that are administered vaginally. Drugs that always have a systemic effect are orally administered drugs, for the most part. There are some exceptions. The exception for this rule will be some drugs that are not absorbed directly exert a local effect on the gastrointestinal tract. Some other examples that are always systemic, drugs that are administered intramuscularly or intravenously. And some drugs can be either systemic or local. It just depends on the type of drug that is being administered. Drugs that are inhaled, drugs that are administered subcutaneously or rectally. It just depends on the type of drug that is being given. All right, now we'll talk about the therapeutic effect of a drug. This is the drug's main action for which it was prescribed, the whole reason why you are taking that drug. The drug is selected to either prevent a disease, to diagnose a disease, or to treat a disease by controlling or improving the symptoms. Now, drugs can be directed toward a specific area of the body, which is called the target organ. And some drugs are not always directed toward a target organ, like antibiotics. And sometimes the therapeutic effect is actually a side effect, such as antihistamines or drugs that treat insomnia. All right, now we'll talk about side effects of a drug. Now, these are the effects of a drug other than their therapeutic effect. These can be mild and temporary, or they can be moderate and annoying, or these can be severe. And they're severe enough, the FDA may not even approve the drug. Now, once a drug is FDA approved, it must list the possible side effects in all of the advertisements for the drug, and the informational literature while it's being prescribed, and also in packet inserts. Now, common side effects are listed as the drug is tested, and there's no drug that is entirely safe without potential side effects. And side effects can vary from person to person. You're going to easily have two people taking the same drug for the same condition. One person get very mild side effects, the other person get more severe side effects. It just depends on that individual person's body chemistry. Now, examples of side effects will vary widely. Some drugs produce very few side effects, and most drugs are associated with at least one or two side effects. Some common side effects for gastrointestinal drugs could be anorexia, could be nausea, vomiting, or diarrhea, or constipation, especially for narcotic drugs. Drugs for the central nervous system, common side effects would include drowsiness, or excitement, or depression. Antidepressant drugs, common side effects of this class of drugs would include blurred vision, or having dry mouth, or being fatigued. And some common side effects of chemotherapy drugs, nausea, vomiting, chills, fever. Some other common side effects, loss of hair, depression of the bone marrow. And the FDA does not take a chemotherapy drug off the market because of the treatment, because the thinking is the life-threatening cancer is a bigger concern than the side effects. So yes, you may have nausea, yes, you may lose your hair, you may have a depression of your bone marrow, but at least you are alive to experience the side effects. Now, when side effects become severe, they'll often be referred to as adverse effects. And these are not as commonly observed as side effects, and these usually become apparent only after a drug is on the market. And these can cause the FDA to remove a drug from the market, even after it's been initially approved. For example, 7 of the 11 drugs taken off the market by the FDA from 1997 to the year 2000 were taken off because doctors kept prescribing certain drugs to particular patients, despite the warnings to the contrary in the drug information. So the information was out there to not prescribe it to a certain group of patients, but doctors were still prescribing it to them anyway. So in the year 2000, the FDA proposed regulations to make prescribing information provided with drugs easier for doctors to use, because the FDA acknowledged that very few doctors would take the time to read the lengthy fine print information sheets that went along with every drug. See, the newly revised drug information begins with a section describing the most important warnings for not describing a drug for particular types of patients, and ends with a patient counseling checklist that the doctor can review with the patient. So some of the more important points, the more important side effects, are listed in the very beginning of a drug information packet. In 2010, the FDA removed from the market the drug Darvon because of an increased risk of heart attacks and strokes. The drug known as fen-phen was removed from the market. This drug would treat obesity, while another drug that would treat obesity fasting was allowed to remain on the market as an appetite suppressant. Now, at the same time that fen-phen was removed from the market, a drug that's very similar to this chemically, Redux, was also taken off the market. Now, fen-phen and Redux were linked to patients developing pulmonary arterial hypertension and also receiving damage to heart valves. So that's why they were removed from the market. But a drug like Fasten was allowed to stay on the market because that didn't have that adverse side effect. The drug Zelnorm was approved by the FDA to treat irritable bowel syndrome and also chronic constipation. But it was removed from the market due to an increased risk of heart attacks and stroke. So these side effects weren't known as it went through the clinical trials, but became apparent after it had already been approved for sale to the general public. So these side effects became severe enough where they were classified as adverse, so it prompted the removal of this drug. The Accutane is a vitamin A type drug, or a retinoid drug, that was first approved by the FDA in 1982 to treat severe acne, severe cystic acne vulgaris. It was not until 2001 that the FDA required patients to sign a consent form prior to being given Accutane because of a possible link to suicide. So as long as the patient signs the consent form, will be allowed to continue taking the drug. Now, the incidence of death or adverse reactions to drugs have more than doubled between 1998 and 2005. So the FDA may require a drug company to mention serious and life-threatening or fatal adverse reactions in what's called a black box warning. Here's an example of how a black box warning would look. This is a bottle of Cipro, generic antibiotic drug. And on the label, you'll see a very clearly identifiable black box. Any information that is key to this drug will be listed in this black box. For this drug, there's an increased risk of ruptures in tendons or tendinitis. This risk is even higher if the patient is over 60 or is on corticosteroid drugs or has had a kidney, or heart, or lung transplant. So information that is very important for the patient to know is listed in this black box. Now, when it comes to adverse drug reactions, these account for over 1.5 million hospitalizations each year. That breaks down to 4,000 a day. After being admitted to the hospital, there's an additional 770,000 patients who develop an adverse drug reaction. So as many as 100,000 Americans die each year as a result of these adverse effects. So it's been estimated that for every dollar spent on a prescription drug, another dollar is spent to treat reactions caused by that same drug. And physicians and pharmacists can report adverse drug reactions to the FDA. So on all prescriptions, the FDA's phone number must be published in a bold type on all drug information. And the FDA maintains the National Adverse Event Reporting System, or AERS. All right, now talk about toxic effects of a drug. And this occurs when the drug's serum levels rise above the therapeutic level. And before a drug can be FDA approved, the drug company must show that a drug does not produce toxic effects when administered in therapeutic doses. And that brings us to a drug's TI, or therapeutic index. This is the narrow margin of safety between a dose that's considered to be therapeutic and a dose that's considered to be toxic. So when a drug with a low therapeutic index is administered, it is not uncommon to see toxic symptoms. Now, when toxic symptoms occur, the doctor can either decrease the dosage of the drug, they can lengthen the time between doses, or they can just go ahead and discontinue the drug altogether. Patients who are on drugs that are known to frequently cause toxic effects will be scheduled for various things, including blood tests to monitor drug levels, another lab test to monitor functions on particular organs, in particular the liver. And this is done on a regular basis, once every 3 months, once every 6 months, once every year, just to make sure that the effects of the drug are not becoming toxic. All right, now we'll talk about the paradoxical effects of a drug. Now, a drug that normally produces a specific therapeutic effect produces the exact opposite effect in certain patients. A common example, benzodiazepines. This is used to treat anti-anxiety. But for some patients, this drug can actually cause anxiety and agitation in some patients. So you're defeating the whole purpose of taking the drug. Now we'll talk about allergic reactions to a drug. Now this is a type of side effect, but differs from other types of side effects. These always have a specific underlying cause. This is caused by the release of histamines. The histamines are released when the body's immune system identifies a foreign substance, and your immune system will initiate an antibody response against it. So being allergic to pollen or grasses or hay fevers or peanuts or shellfish, being exposed to those things when you have an allergy to them, how your body responds to that is based on your immune system. Now, antigen does not provoke an allergic reaction in everyone, only in certain hypersensitive people. So histamines, these can produce anywhere from a mild allergic symptoms to very severe allergic symptoms, and this depends on how much is released in that individual person. Now, these reactions can be mild or they can be life-threatening, and the most severe symptoms of an allergic reaction are known as anaphylaxis or anaphylactic shock. This is a very sudden, very acute very severe allergic reaction, and these are very life-threatening. Some examples of a mild allergic reactions include itching or swelling, redness or sneezing. These are all, by definition, allergic reactions. Your body is responding to the presence of something that you are allergic to. But these are not all that serious. They are more irritating than anything else. And some examples of severe to life-threatening allergic reactions: bronchospasms, edema or swelling, shock, then even death. This image, we have an example of an allergy band that a patient would wear. This is why whenever you see a doctor in any kind of setting, you're asked, what drugs do you take? Are you allergic to any drugs? If you are allergic to drugs, it's important that you're able to notify other caregivers quickly that you do have an allergy. So you would wear something like this. Now, anaphylactic shock is not common, but it's often associated with antibiotic drugs, although other drugs may also produce this effect. Now, what's interesting here is a patient may take several courses of an antibiotic drug over many years and have no reaction, but then the next course of the drug will cause a reaction. So it's not always the immediate exposure to a drug or to an allergen that causes these reactions. Sometimes it's something much, much later on. So once a patient is sensitized to a particular drug, even a small dose can trigger an allergic reaction. Okay. In addition, some drugs will show a cross-allergy to other drugs because of the similarities of their molecular structures. So you may not be exposed to your specific allergen, but something very chemically similar to that. So something very close to what you're allergic to may cause an allergic reaction. For example, patients who are allergic to penicillin should avoid other drugs in the penicillin group, like ampicillin, for example. And these patients may also have a hypersensitivity to cephalosporin antibiotics, like Keflex or Seclor, because those are very similar in chemical structure to penicillin drugs. All right, now we'll talk about idiosyncratic reactions to a drug. These are drug reactions that are not a side effect, and these are not based on an allergic reaction. And these are going to be unique for each individual person who takes a drug. So these are not adverse effects, these are not allergies, they're just very odd reactions produced by the drug based on that person's body chemistry. Now, the basis of these idiosyncratic reactions are the genetic makeup of the individual. Some genetic factors are responsible for the variations in the action of a drug and the metabolism of a drug. Now, certain ethnic groups have well-studied idiosyncratic reactions to drugs, such as Asian people or Jewish people or people of African descent. And that leads you to pharmacogenetics. This is the study of how the genetic makeup of different people affects their response to certain drugs. And of course, this is something that the patient can't control. But knowing how certain drugs may affect different groups of people differently is important to understand before you prescribe these drugs. An example of an idiosyncratic reaction to a drug, a malignant hyperthermia. This is an uncontrolled elevated body temperature. Now, this occurs in 1 out of 20,000 patients given the inhaled anesthetic drug halothane. Now, this can also occur in patients that are given succinylcholine prior to surgery. Now, this reaction is caused by a genetic variation in one known gene. Now, this may involve up to 6 different genes. This idiosyncratic reaction can result in death. All right, now we'll talk about drug-drug and drug-food interactions. Now, many patients take more than one drug on a daily basis, especially true for older adults. They make up 15% of our population, but they take 33% of all prescription drugs. And that often leads to something called polypharmacy. This is when patients take both prescription drugs and over-the-counter drugs. So the more drugs that you are taking, the more likely that you're going to have a drug-drug interaction. Now, when administered simultaneously, some drugs will interact with one another. This can either accentuate the action of each or diminish the effect of each. The way to optimize the therapeutic effect of a drug and also minimize the occurrence of adverse or toxic effects is to take the drug exactly as prescribed. But for many elderly people, this is a lot easier said than done. Taking multiple drugs that have varying schedules, given several times a day or daily or weekly, can be very confusing. Add to that common problems that go along with aging, memory loss, vision loss. All those will increase the possibility of non-compliance, which is missing a drug dose, or toxicity, where you take too many, where there's an overdose. Now, a drug dose container can be purchased at any drugstore or pharmacy, and this can be an inexpensive solution. And this is how one of these would look: a pretty standard rectangular shaped box, often color-coded for morning here and then evening. Now, there's a new FDA-approved computerized unit that's about the size of a bread box known as EMMA, Electronic Medication Management Assistant, which holds individualized doses of a month's worth of drugs. Now, the EMMA will plug into a regular outlet and has a wireless connection to the internet to access the patient's medication administration record. So when it's time for a drug dose, there's an audible alert that goes off. Then the patient goes to this box, pushes a button on the touchscreen, and then the drug dose is dispensed. See our next term, synergism. This occurs when two drugs combine to produce an effect, and the effect that is created is greater than either drug on its own independently. Now, in many cases, synergism is beneficial, such as Tylenol taken with codeine. If you take Tylenol by itself, it has an effect. If you take codeine by itself, it has an effect. The effect when they're taken together is greater than they would be if taken individually. That's why it's a synergistic effect. Another example would be a potassium-wasting diuretics taken with a potassium-sparing diuretic. And it's something we'll talk about in a future chapter when we get to the drugs that affect the urinary system. Now, in some cases, synergism is very undesirable, such as combining tranquilizers and alcohol or antihistamines and alcohol, because you have the side effect of the drowsiness is heightened and the sedative effect of alcohol is heightened. So this often has a fatal result. So if you take tranquilizers by themselves, they have their own effect. You take alcohol by themselves, it has their own effect. You take them together, their effect is multiplied, so it makes it even worse. So this is exactly what you don't want to happen when taking these types of drugs. Now, the opposite of that, antagonism, this occurs when two drugs combine with each other to produce an effect. Now, the effect is less than the intended effect of either drug independently. So, for example, taking tetracycline with an antacid. Tetracycline by itself has an effect. Antacids by themselves have an effect. You take them together, and their effects are lessened, so they have a much lowered effect. See, drug-food interactions. There are many examples of when certain drugs should not be taken with certain types of food. For example, tetracycline cannot be taken with milk. It will not be effective. MAO inhibitors can't be given with foods that are high in tyramine. Taking this type of drug will cause a very serious spike in blood pressure, and it will require emergency treatment. Now move on to a drug alert. Now, the beneficial effects of drinking grapefruit juice may turn into a toxic effect if you're taking certain drugs. This is because grapefruit juice blocks an enzyme in the intestine that would normally break down a part of that drug before it enters the blood. So when this enzyme level goes down, much more active drug enters the blood, which can result in a toxic level. So this is how this would look. You would see a warning, do not eat grapefruit or drink grapefruit juice when taking this medication. For example, an antihistamine drug that's taken with grapefruit juice can cause the adverse effect of heart arrhythmias. A cholesterol-lowering drug taken with grapefruit juice can result in toxicity of blood levels that can be up to 15 times higher than normal. Okay, now we'll move into systems of drug measurement. And here are a few that we will cover here briefly. We have apothecary, there's metric, and then there's other types of systems, avoirdupois, and household systems. Our first system we'll talk about is the apothecary system. Now, some of these apothecary measurements are still used today. These include liquid measurements such as a pint and quart and gallon. But other units that were used in this system would be grains and scruples and drams. Now, this system of drug doses for measurements has been discontinued. And the system also used a variation of Roman numerals with their measurements. Like I mentioned, one of the units that is used in the apothecary system is grains. So on this bottle of nitroglycerin tablets, you see the regular dosage that would be used, the 0.4 milligrams, but the equivalent to that in the apothecary system is 1/150th grain. And here's what I mean by the Roman numerals used for drug dosage. And these were used in handwritten prescriptions. Our next is the metric system of drug measurement, developed by the French in 1790. It's also known as the International System of Units, or SI units. And this has been adopted as the exclusive unit of measurement by the AMA, American Medical Association. And this is a much easier system to use because it's all based on powers of 10. And there are some standard units that are used in the system. When you're measuring length, you use meter. For weight, you use kilograms. And for volume, you use liter. A very common length measurements that come up, centimeter, for example. And prefix centi means 100th. So a centimeter literally translates to 1/100th of a meter. All right, a quick focus on healthcare when it comes to measurements involving medications. When you're using a liquid in a a tubing, for example, what we end up having is a cube that is formed that is 1 centimeter long on every single side. So this is known as a cubic centimeter, or cc, and that is equivalent to 1 milliliter. So 10 cc's, or 10 cubic centimeters, is exactly the same thing as 10 milliliters. So those are equivalent in measurement. So these units are used often to express volumes of liquid drug doses. And even though the main unit for weight in the metric system is kilograms, when you're talking about weighing out drugs, obviously you will not use kilograms. A kilogram is 2.2 pounds. So if you are prescribing that amount of weight in drugs, you're going to kill somebody. So when it comes to drug dosages, you'll be using milligrams, decagrams, and so on. And so kilograms are used to measure a person's weight. So this is important when calculating correct drug dosages. For example, 50 kilograms is the same thing as 110 pounds. And then most drugs will be measured in milligrams, micrograms, decagrams. So it is important to know how to convert pounds from kilograms and then vice versa. Otherwise, you'll be prescribing drugs that are way too low in quantity or way too high in quantity. When it comes to the measurement of volume in a metric system, you'll be using liter and variations of that, such as milliliter. And 1 liter is the same thing as 1,000 milliliters. And again, when it comes to prescribing drugs, you will not be using liter. If you are prescribing drugs by the liter, you're going to kill somebody. So that's why you almost always will be using milliliter or less. Alright, when it comes to drug measurements in the metric system, they are never expressed as fractions. If a drug dose is less than 1, it will be written as a decimal and always has the number 0 in front of it. So you'll never see 0.5 milligrams of something. It'll be 0.5, 0.1. Because it'd be very easy just to overlook the decimal. So instead of prescribing 0.5 milligrams of something, you may be giving 5 milligrams of something, which is quite different. This table is some very common units of measurements and equivalents. 1 kilogram is 1,000 grams. Kilo always means 1,000. 1 gram is the same thing as 1,000 milligrams. 1 milligram is 1,000 micrograms. And the prefix micro always means 1 millionth. There are some other drug measurements. One of these is a generic unit. Some drugs are never measured by the metric system, but instead by a special designation called a unit, such as penicillins. So 1 unit would be 0.6 micrograms of penicillin G. So all types of insulin are defined by the weight of pure insulin, and these will be manufactured in 100 units per milliliter. And you'll see this abbreviated on the packaging as the letter U and 100. And the exact value will vary from drug to drug. Alright, this image we have an example of Humalog, which is a human form of insulin created by using recombinant DNA technology. And you can see here 100 units per milliliter indicated by this U100. Alright, this image we have an example of an insulin syringe. When dispensing insulin, you'll be using a different type of syringe as opposed to what you would use for other types of liquid drugs. You can tell here at the bottom of the syringe, you'll have the word units. See other drug measurements, the inch. There's only one common medication that uses this unit when it is dispensed, and that is a nitroglycerin ointment, or nitro-BID. This is a pad of specially marked paper, and the ointment is actually squeezed onto the paper itself. And the prescribed doses for this drug would range from a half-inch square to a 4-inch square. The other drug measurements, using drops. This will be abbreviated on the prescription form by the letters G, T, T. These are common for eye medications and ear medications. The milliequivalents. An equivalent is the molecular weight of an ion divided by the number of hydrogen ions it reacts with. So a milliequivalent is 1/1000th of an equivalent. So this unit will be abbreviated by the letters MEQ. Here's an example of a drug that would use this unit, chlorcon, which is a potassium chloride. You see the dosage written 2 separate ways. This drug is 750 milligrams, but also the same thing as 10 milliequivalents. Another type of drug measurement is a percentage. And it's like a percentage represents in math. It's one part in relationship to the whole. This is based on a total of 100%. So a 10% solution would be composed of 10 milliliters of the drug in a 100 milliliters of liquid. So the drug is 10% of the overall liquid container. In this image we have an example of a drug that uses the percentage unit for measurement, hydrocortisone. You see very clearly marked 2.5%. This drug can also come in 0.1% or 0.2% or 0.5 or even 1%. The drug is 2.5% of the overall volume of this tubing. Another drug measurement, type would be ratio. This represents a relationship between the concentrations of two substances that are together in a solution. This is expressed as two numbers with a colon in between the two, just like they are in math. Another kind of drug measurement is the household unit measurement. This is an unofficial type of measurement. This is used by people at home measuring their own drugs, using such items such as a spoon or silverware. This is incredibly inaccurate because there's no standardized size. You consider to be a big spoon, the person next to you may not consider to be a big spoon. So you'll see a lot of this in home remedies when people have their own version of what will make you feel better. Alright, now we'll move on to the 7 rights of drug administration. Now, every year, 1.5 million people are harmed by drug errors. And there are some recommendations by the IOM, the Institute of Medicine. Some of these include that all prescriptions should be created electronically. That way there's no confusion on what was handwritten, for example. And drug information and drug inserts should be standardized. So if you get a prescription for LASIK from one doctor, the insert you get about that drug from that doctor should be exactly the same as someone 1,000 miles away. It's the same drug, same dose, you get the same information about that drug, regardless on who is prescribing it. And each patient has approximately 1 medication error per day. Maybe skipping a dose, maybe taking more than you should because you forgot you took it that day, taking it with food when you shouldn't be taking it with food, and so on. And the Archives of Internal Medicine has found that drug errors occur in 1 out of every 5 doses that are administered in a hospital. 20% of all meds given in a hospital setting are done incorrectly. The 7 rights of drug administration. Number 1, which seems fairly obvious, is getting the right drug. Now, generic drug names are often complex. Trade name drugs can have similar sounding names. So it's important that you check the drug name against the medication order. Checking it when the drug is taken from the cart or off the shelf, as it's being placed in a cup or poured into a cup, and before giving it to the patient. Make sure they are getting what they're supposed to be getting. And never administer a drug prepared by another person. No matter how much you trust them, if you don't prepare it, you shouldn't be giving it to someone else. Because if you do, then you are liable for what happens after that point. Alright, this image we have an example of Zyprexa. And one of the ways to help distinguish between look-alike drug names is by putting capital letters within the word itself. Those are called tall man letters. The Prexa part of Zyprexa is capitalized. For normal grammar, you wouldn't be doing that, but it's to highlight what this drug is, to distinguish it from other drugs that sound similar to this. All right, number 2, the right drug form. The same generic and trade name drugs can be manufactured in several different forms. So the drug form is noted on the prescription or the medication order, so there's no confusion. So making sure that if the prescription is for an oral administration, make sure it's not given in a spray form or in an effervescent tablet. Number 3, the right drug dose. Now, calculating drug dose is an extremely important process. Now, for adults, the standard adult dosage is appropriate for almost everyone. This is preset by the drug company during the process of going through the clinical trials. Now, the patients who fall outside of this range will have to have their dosages adjusted. Those could include those who are elderly or who are very thin or very obese. Making sure you're giving the right dosage for pediatric patients, especially for infants or premature babies. This has to be calculated with great accuracy. Even a slight error can be incredibly dangerous. And these dosages are based on the total weight of the patient, not the age. And these are often expressed as milligrams per kilograms per day. The amount of milligrams of the drug per kilogram of the body weight of that patient per a 24-hour period. Making sure you're getting the right dose when it comes to chemotherapy drugs. Now, this is calculated based on the patient's total body surface area. So this is customizing the dose for each patient to maximize the effectiveness of the drug and also to minimize any side effects. So this is expressed by milligrams per square meter of body surface area. If you have 2 patients who are receiving the same chemotherapy drug, one is 300 pounds and one is 100 pounds, obviously they're not going to get the same dosage, because giving both of them the same dosage will make one very, very sick or have very little effect on the other. So when it comes to chemo drugs, it has to be calculated by body surface area. Alright, number 4, make sure you're getting the right route of administration. It's important to check the prescribed route and making sure that the drug form that you're prescribing is compatible with that route. Alright, number 5, the right time. This is measured in the frequency of the dosages. Twice a day, 3 times a day, in the morning, or at bedtime. There are a number of commonly used abbreviations that indicate frequency. And these are all based on Latin phrases. BID for twice a day, QD every day, QH every hour. It all comes down to what's called chronotherapy, to coordinate the administration and metabolism of a drug to the body's own biological rhythms. There are important reasons why you take some drugs right before you go to sleep, or right when you first get up in the morning, or right after you eat, or right before you eat. There are important reasons why you are told to do those things. All right, this table we have some very common abbreviations. Drug administration. Let's see, BID, bis in die, which means twice a day. NPO, nil per os, nothing by mouth. PC, after meals. So these are all very, very common. Again, they're all based on Latin phrases. All right, number 6, right patient. In home situations, dispensing to yourself is not difficult. In a healthcare facility, many patients receive drugs, so being able to correctly identify the patient is crucial. This is why when you're in a hospital setting, almost everyone that you see asks you to confirm your full name and your birth date, and sometimes what you're being treated for, to make sure that they know they are talking to the right person. And number 7, the right documentation. Only after a drug is administered should information be entered in the medical or medication admin record, such as drug name, form, dose, the unit that was used to measure it, and the route of administration, and then the signature or the initials of the person who administered that drug. So all 7 of these steps, the 7 rights of drug administration, many of them are common sense, but it is important to follow them that there's less of a chance to having a drug error. But the more you can do to help eliminate those possibilities, the better. All right, that brings us to the end of chapter number 5 in our video series on pharmacology. We will continue our video course with our next video on chapter number 6, the prescription, the pharmacy, and the pharmacist.